in the development community to discuss the role and importance of evidence in decision making. And so we really hope you will enjoy listening in today. My name is Marie Gardner, and I'm the Executive Director at 3IE. 3IE is a global leader in funding, producing, and synthesizing rigorous evidence. We partner with governments and development institutions globally to understand and meet their evidence needs, also in facilitating the use of existing evidence or generate new evidence. We also support efforts to institutionalize evidence-informed decision-making. Also, we address barriers to evidence use by investing in and managing and maintaining a variety of innovative public goods, global public goods aimed at improving the use of and access of rigorous evidence. So without further ado, I'm going to talk about a few housekeeping notes. So when sending questions to the presenters, please use the Q&A box for questions at the bottom of your screens, not the chat function. And if possible, unless it's a more general question, so please name the presenter you would like a response from. If the event is disrupted for any reason, we will shut it down and reach out to you via email. The event is being live streamed on YouTube and shared on social media. And so if you're joining our event via live stream, please leave your questions in the comments box. Also, we encourage you to tweet any questions or points of view on X. And in that case, please tag at 3IE News while you tweet and use hashtag evidence dialogues. Now, before we dive into the panel, I want to say a few words about our motivation for bringing this panel together. So the evidence panel is to announce the launch of this new special issue of the Journal Development Effectiveness on transparent, reproducible, and ethical evidence. It's a mouthful, and we call it the abbreviation is TREE. So it must be so when you hear about TREE, that's what it stands for. This evidence dialogue will feature presentations by the authors of several of the papers included in the special issue. And in addition, it will also cover a discussion about the journal's recent policy on authorship, ethics, and transparency. So we hope that those in evidence generation and practitioners in the field of development research will find the evidence dialogue insightful and practical and useful for their own research. Also, let me brief you about 3IE's own TREE initiative. Transparent, reproducible, and ethical evidence are core considerations of 3IE's work and are in line with our stated values surrounding respect and quality. And so the TREE initiative plays an essential role in ensuring that 3IE's work is in line with 3IE's TREE policy. And so through the help desk service and work on data center and survey management, the initiative supports various research teams to incorporate best practices into their research workflow. The initiative has also supported multiple capacity building initiatives and developed training material to promote the uptake of TREE best practices. And over time, the TREE initiative has developed and refined tools and best practices to ensure our studies apply rigorous methodologies, transparently share design and analysis decisions, yield reproducible analysis, and incorporate foundational principles of research ethics into design, implementation, and also dissemination. With that, let me pass it to Dr. Sudhanshu Handa. So Ashu Handa is a 3IE Senior Research Fellow and Kenan Eminent Professor of Public Policy at the University of North Carolina at Chapel Hill, and also my co-editor of JDEff. So over to you, Ashu.
Thank you, Maria. Good afternoon, everyone, or good evening, good morning, depending on where you are. So as Marie mentioned, we're launching the special issue of TREE. We have some representative papers from authors to give us a little bit of a taste of what the special issue contains. Before we go into that, we wanted to actually discuss a specific kind of initiative that we've launched at JDEff. That's the Journal of Development Effectiveness, which is housed at 3IE and really managed by 3IE. So JDEff is the first social science journal to adopt a position on authorship, ethics, and transparency in research. And I think some of the team will put some key links for you to the JDEff website so you could see what we're talking about. So we are asking authors to do a couple of things now when they submit papers. The first is for papers that involve primary data collection in a low or middle income country. Here we will ask authors to provide a short reflexivity statement that will be published, an author reflexivity statement. And this will essentially explain the contribution of each author to the work. And in particular, where there's no author from the country where the work was done, we will ask authors why not? Why was that not the case? So we're hoping that this will increase awareness around issues of equity. It will increase transparency, and in particular heighten the awareness around helicopter research, this idea of researchers flying into countries and basically extracting data without clear and genuine involvement and partnership in countries. The second thing that we're doing is for papers that have an RCT or that interview vulnerable groups, so that include primary data collection, we will ask authors to fill out a small ethics appendix, okay? And so this will just be a set of questions about research ethics and trying to, again, create awareness around the ethics of data collection and equitable and inclusive approaches to research. So we're hoping that other social science journals will follow our lead and that this will eventually become the default. So with that, let me pass the mic back to Marie. Thank you so much.
Wonderful. Thanks, Ashu. So now we will dive into the individual presentations by the authors of, or some of the authors for this special issue. And each author will have around 12 to 13 minutes to briefly discuss their paper. And then we have a really short time, about 2 minutes, just to take 1 or 2 questions. And I will be monitoring the Q&A to do so. And so again, please include your questions in the Q&A. And then at the same time, of course, if there are more questions, I'm hoping that panelists can also take some of them and answer them in the Q&A itself afterwards. So hopefully getting to some more of your questions, given the short time. So first, we have a presentation by Dr. David Evans. David is the Principal Economic Advisor for the social sector at the Inter-American Development Bank. And he will be presenting a paper titled Towards Improved and More Transparent Ethics in Randomized Controlled Trials in Development Social Science. So over to you, David, to present the paper.
Thank you so much, Marie and Ashu, for opening the session, and to 3IE for inviting me to participate in this. Can I just clarify, are my slides showing in the right way? Thank you. Okay, so yeah, thank you very much for organizing this, and I'm excited to share this. I think, as won't come as a surprise to anyone, RCTs have been on the rise in development over many years. Here's some evidence that came out of 3IE work that showed the rise just through 2012, but there's continued to be, I don't think the rise has been quite as steep in the last 7 years from some more recent work, but it's still, there are a lot more RCTs in development economics than there used to be, which is my field. They still aren't the majority of development research, but they matter a lot. And they've given rise to lots of debates about many issues. On the one hand, critics argue that they distract people from big questions, and proponents argue that they're still the minority of development research, that you can still test important policy questions with RCTs. Proponents argue that there are methodological advantages, and critics argue that those are not as robust as proponents propose. Critics say, RCTs are testing interventions that are already known to be effective, and proponents will say, well, it might be effective in one context, but whether it's possible to implement that and have the same effectiveness in another context is an open question, or whether it's the best use of resources in that context. Critics argue that we're potentially excluding individuals from treatments that may be beneficial. Proponents argue that initial coverage is often incomplete anyway, and that randomization might improve. In some cases, definitely does improve on existing allocation systems. So there are a lot of debates about these questions. I'm not going to settle these. The objective of this article is to provide practical suggestions to improve the ethics and the ethical discussion in randomized controlled trials at 3 stages: planning the trials, conducting the trials, and then, of course, reporting on the trials. I think it's important to remember that a lot of the points I'm going to talk about apply to lots of other types of impact evaluations, not just randomized controlled trials. This reminds me of a tweet or an X post that Pamela Jakila posted when Angus Deaton and Nancy Cartwright posted some critiques of RCTs, and many of them just applied to studies in general. And as Dr. Jakila says, it's a nice insight, but for some reason they keep spelling study as RCT. So just remember that RCTs do have some unique elements, but many of the ethical issues that we think about really relate to any study that we do in a vulnerable context, and especially any study that involves primary data collection. And then lastly, I'll just point, there are a lot of other sources that look at practical suggestions for ethics, and I've listed a few here. We'll hear from one of the authors of one of these, Doug McKay, in just a few minutes. But so let me talk about a few of these issues. I'm not going to be able to talk about everything in the article in the 13 minutes, but I will hit a few highlights. So first, when we think about planning RCTs, I have 7 suggestions. The first couple are, well, is an RCT the best way to learn what you want to learn? And then the second, is an RCT justified in this situation? So of course, like all good questions, these questions lend themselves to others. So is there a quasi-experimental method that will deliver a convincing answer? So people that don't believe that RCTs are ever ethical will often say, well, yes, of course. But honestly, a lot of quasi-experimental methods don't deliver convincing answers. We've seen there are many studies that compare randomized controlled trials and quasi-experimental methods. And in many cases, the quasi-experimental methods fall dramatically short. In other cases, they deliver very convincing answers. And so this is a question we can ask honestly. I think a second question that comes out of this is it more ethical to evaluate or not evaluate? Most of my career has involved working with governments to evaluate public policy programs that they are already implementing, often without any sort of evaluation in place. And so they're spending lots of public resources on these programs, and without evaluating them, those resources may often be wasted. The third point is whether there's doubt about the merits of this intervention and whether there are doubts about the merits as implemented in this context. A great example of this is an early childhood intervention that in Jamaica showed enormous impacts. But when that intervention was replicated in several other countries in Latin America, the results were much, much smaller. And if they hadn't evaluated carefully in other contexts, if they had just assumed, well, hey, look, we know this intervention works, then they would have made a very erroneous assumption about the impacts. One thing I should have said up front is I am not an ethicist, but I am a practitioner. I have implemented about a dozen randomized controlled trials over my career, and I've spent a lot more time than that thinking about and synthesizing impact evaluations, including RCTs. Okay, I think a third point important as we think about these evaluations is taking potential risks to participants and implementers seriously. So is the RCT encouraging participants to take a risk, right? Is it encouraging them to invest in some instrument that might involve a risk? Are there risks to enumerators because they're going into dangerous situations or asking risky questions? And then so does the value of the question merit those risks? And can you mitigate the effects of that risk? And so some examples are studies where, for example, with an RCT, they just delivered the program to the most vulnerable, but then randomized amongst the less vulnerable. Or a program in Rwanda where teachers were randomized into different contracts. Some of the contracts were worth a bit less on average, but those teachers received a signing bonus so that on average, they were no worse off. A third was an intervention that was going to take place around the time of an election, and the researchers shifted the timing just so that it would be a safer time for enumerators to be evaluating. So these are all important questions to ask. We heard from Ashu earlier about questions about engaging with local scholars and populations. There are lots of ways to do that. One way is to have co-authors. As you can see, some great work from Panin that showed that the vast majority of Africa articles, including experiments, do not, have zero authors with an affiliation in Africa. On the experiments, there are actually authors with an affiliation with an African institution, but the number is so small that it doesn't show up in this bar chart. It's 6, and so that should just tell us something. There are a lot of ways to engage with local scholars and populations in addition to authorship, and in terms of consultations and engaging policymakers, and I think there's merit to all of those, but authorship is certainly one straightforward way. I'm not going to talk about institutional review boards, although that's very important. Doing RCTs in ways that we ensure accurate, replicable, and transparent results. It's unethical to waste resources on research that is poorly done. But I'll leave those for another discussion. I think the last point I'll mention on planning RCTs is the importance of establishing a plan for use from the start. So what I'm sharing from here is a template for the policy influence plan that I actually got from when I received resources to implement an RCT in Mexico from 3IE many years ago. And they had this policy influence plan. And I admit, as a researcher, I was like, oh my gosh, this is the biggest pain in the behind. I spent so much time when I was trying to focus on implementing the RCT, going around and briefing policymakers that I had identified early on. It was incredibly helpful. And so there is a cost to investing this planning up front, but there's also an enormous payoff in terms of policy influence. And if you don't establish that plan for use from the start, then the possibility of those results having impact diminishes dramatically. And again, it's just a poor use. It's an unethical use of resources to invest in these evaluations that aren't going to have a return in terms of policy influence. So those are some suggestions as we think about planning RCTs. So 2, for conducting RCTs. So 1 is ensuring informed consent in data collection and at the right level for RCTs. So with data collection, we essentially always seek informed consent. With participation in the RCT, especially with cluster RCTs, right, where you're randomizing at the level of the school or the level of the community, then usually the consent is sought not at the level of every individual citizen, but at the leader of that group. With government programs, this often depends on a principle of right to rule, like if the government has the right to implement programs. And then this is always weighed against potential harms. And so this is something you can explore with an ethical review board. A second point that is compensation of subjects. So with any data collection, and then also with randomized controlled trials where you're manipulating treatment, you're taking subjects' time. And so it's important. There are many surveys that compensate subjects with some sort of in-kind gift. At the same time, it's important to avoid, if you've got highly vulnerable participants, a compensation that would make participation irresistible, right? So they essentially have no choice but to participate. One principle that some researchers use is no survey without service. So having, whether it's an in-kind payment or some sort of training or information campaign, providing some resources to control schools that don't compromise the experiment. So those are other issues to be thinking about. So I'll talk, just to wrap up, I'll talk about 3 points around reporting RCTs. So one is discussing ethical issues explicitly. And so Ashu talked about how at the Journal of Development Effectiveness, there's going to be a requirement to include an ethics discussion appendix. I was first introduced this idea from a great paper by Asiedu et al., where they provide, questions to discuss. And, I think this is a really valuable area that I don't think has been taken up as much as I'd expect. I'm glad the Journal of Development Effectiveness is implementing it, and I hope to see more of this. There are a large range of issues that will help people understand how you as a researcher have thought about these ethical issues. There will always be disagreements about these, but having an explicit discussion about this allows for an informed and thoughtful discussion. A second point is crediting a wide range of contributions. So Ashu talked about, and I mentioned earlier, the value of having co-authors who are from the context, but also just recognizing that even beyond authorship, there are a wide range of contributions and finding ways to credit those contributions within the paper, whether it's with authorship or with its other forms of acknowledgement. Just making sure that, hey, other people contributed to this paper, and there are ways to recognize that. For example, with the credit contributor roles taxonomy, I know with the transfer project that Ashu led, they had a tradition of recognizing the team in addition to the lead co-authors. And so there are a number of ways to do that. And then something I don't discuss in the paper, but I think is important, is the value of returning research results to participants in the study. Melissa Grabois, Ted Miguel, and others are doing interesting work on that right now, which I would recommend. So I'm confident that I'm out of time, but I'll just wrap up to say, it's very important to evaluate social programs, and randomized controlled trials are an important tool in that toolbox. We need to do these ethically. I've seen a lot of storms about the ethics of RCTs over the course of the last 20 years. There is no, you could do everything that I've suggested, and there's nothing there that will give you an impenetrable shield against criticism. But engaging with these issues thoughtfully and discussing the results of that process is the right thing to do. It will help your evaluation, and it will help the field of development more broadly. Thank you very much.
Thank you very much, David. Excellent talk. And I am just double checking. I don't think I have received any Q&As from anyone online. So just to mention that this is your chance to come in with questions. I do have a couple of questions, and also we'll invite Ashu if you want to either make a comment or include a question to David to come in. So really interesting. I think particularly for me, I mean, it all resonates, right? But particularly the issue about it being unethical to, in a sense, not plan for the use of the research. And so any thoughts around how to what extent this is different for RCTs or research sort of focused on development effectiveness in international development compared to more sort of theory and theoretical and formational type of research. So that's one question I had. The other one is around informed consent, and thinking about, we come across, which is, we all think it's important. However, we sometimes come in these situations where there are particularly additional interesting research that could be done afterwards that we realize, but we haven't gotten consent for that type of research. And so back to the idea also of sort of making data available, but then again, it's sort of we haven't necessarily gotten the consent to use it for other ideas, etc. I mean, so any thoughts around how to weigh those areas up? And then finally, I was very curious. You said you had much to say about IRBs. I do too. I've seen things come through at the 3IE over the years. I've reviewed about 700 plus proposals for impact evaluations at 3IE, and I've seen things that have been cleared by IRBs where I had big questions, and just wondering whether you have any thoughts on how to to make them function better for what we need them to function for. And I don't know, Ashu, if you want to add anything. No, so I'll over to you, David, for any thoughts on this.
Yeah, thank you. Those are great questions. So first, in terms of having a plan to use the resources, I was listening to a radio show in the car with my family the other day, and they talked about some kind of relatively obscure research, and my spouse was like, "That is a waste of money. Like that money should have been used on some other research." And I'm always like, well, somebody reviewed it and made that decision who was not me. And but there's an opportunity cost to all research funding. And so, if we don't make a plan for that research to be used, in some cases, it's an immediate use in the country, which is what that policy influence plan is really helpful for. In addition, it's important to make sure that our research can be used and applied in other contexts. And that's how, making sure that we publish it, make sure that we make it transparent. I think this is especially true in research that we do in vulnerable contexts, just because the risks are higher. No matter how careful we are, there is some risk, right, around engaging people. We're using the time of, at the very least, very vulnerable people. And so I think the onus is higher to make sure that we're doing research that we really believe has the potential to help to improve people's lives. On the second, in terms of consent and whether data can be used secondarily, I think that two things I would say. I think we can build into the initial data collection. Some mentioned that this data is being used for this research project, and something about continuing to learn. And then I think the second part is just making absolutely sure that as we share data, which I think is incredibly important, but we share it in ways where it is truly de-identified, and so participants are protected. So we're not putting anybody at additional risk by posting this data and letting people continue to learn from it. I think that is the right and ethical thing to do, but in a way that essentially zeroes out any future risk to participants. And the third thing on IRBs, I think institutional review boards are very important. They are incredibly heterogeneous. I don't have broad suggestions on, how to make them better, but I will just say, I think we need to use them both in the countries where we're working and in the institutions that we work at, but we can't depend on them. And this is why these other measures of thinking carefully about ethics, about discussing ethics in the appendix of your paper, are so important, because, we've often seen virtually every RCT that I've seen enter into a big controversy about the ethics has been through at least one and sometimes multiple institutional review boards. And so, we can't depend on them, even though we need to use them, is what I'd say on that.
Wonderful, thank you. I'm seeing questions coming in, and we'll take them in future rounds, because I think some of them are general, and we'll get back to panelists to be able to talk to them. So with this, let's go to our second presenter. So we have Douglas McKay. Douglas is an associate professor at the Center of Bioethics, University of North Carolina. And Doug will present his paper titled Policy Equipoise and Interventional Superiority. So over to you, Doug.
Great. So yeah, thanks to 3IE for this session, but also just being very committed to ethics and research. And my primary appointment is actually in the Department of Public Policy. And just a shout out to Ashu for hiring me into this job over 10 years ago. And he's just been very supportive of this work, which has really been the focus of my research the last 10 years. So unlike David, I'm an ethicist, not a practitioner. And so I think that's gonna come out just in terms of what I'm talking about in this paper, and how I talk about it. And I think if I was going to sort of situate myself in thinking about like where this fits in 3IE's commitment to tree, It's really about trying to think about the sort of foundational principles of research ethics, look for ambiguities, and figure out how we should be resolving them in the most defensible way. So my paper is on policy equipoise and how we should use it to evaluate planned RCTs. And just a way to get into the problem I want to talk about. Just imagine that you are a policymaker and you're trying to decide whether you're going to supplement the existing social safety net with a small cash transfer, maybe for households in poverty. And you already have a lot of evidence about its effectiveness in similar jurisdictions from high quality studies. And what the evidence shows is that the cash transfer is very likely to improve consumption and food security, but there's still a lot of uncertainty about whether it's going to be effective in terms of addressing the prevalence of low birth weights, improving child nutrition, and improving the use of healthcare services. And so there's a question, whether you should just roll out the program to all households, or whether you should be concerned about this uncertainty and instead maybe conduct a large-scale randomized control trial where you're randomly assigning some people to the existing social, or just keeping them on the existing social safety net, and then others to the existing social safety net plus the cash transfer. And so one norm you might appeal to try to help you think through this is this idea of policy equipoise, which is derived from a similar principle in clinical research called clinical equipoise. And I would say in some ways is kind of an emerging norm in thinking about the ethics of RCTs in particular. And it's actually mentioned in the structured ethics appendix that David was just talking about by Asidu and all. And then I've also done some work to think about it as well. And so the general idea is that it's okay, it's permissible, it's fair to randomly assign people to 2 or more interventions if, looking at the evidence, thinking through this from a kind of expert community perspective, there's real meaningful uncertainty about which of these interventions is superior, whether intervention A is better than intervention B. And for the most part, when we're talking about superiority here, we're largely thinking about which is more effective in realizing the outcomes that we care about, and not necessarily all things considered better or superiority. So, just for the time being, sort of excluding questions of cost, political feasibility, and so on, those are incredibly important for thinking about whether we do an RCT or whether we implement something, but I think they come in a slightly different way. The other thing just to note about this idea of meaningful uncertainty, there's also this idea that there's sort of uncertainty where we don't have enough evidence to really be decisive in terms of thinking that one intervention is better than another. And then we have this idea of an epistemic threshold. So once we sort of reach a certain level of evidence, we can say that there's a reasonable expectation that one intervention will be more effective than another. Okay, so if that's our standard, how do we apply it in this case? And I think that there's a question mark here. So on the one hand, there seems to be pretty clear evidence that a cash transfer plus the existing social safety net is reasonably expected. So we've sort of met that epistemic threshold to be better on 2 of these outcomes than just the existing social safety net. But there's a lot of uncertainty on the others. And so I think, just from the standpoint of the paper and kind of the problem of the paper is equipoise satisfied in this case or not? So on the one hand, it looks like, one set of interventions is better on 2 outcomes, but there's still a lot of uncertainty. And so is this uncertainty enough to say, hey, we actually don't know which is better? And so the problem that I see here is what I call the problem of interventional superiority. So how do we tell when one intervention is superior to another? So when is policy equipoise disturbed? And this is important just in the sense that insofar as it's ethical to randomly assign people to 2 or more interventions when equipoise is satisfied, when it's disturbed, it might not be the case that it's okay to randomize. And so I think, policy equipoise applies really nicely when we have just one outcome we care about, and we can just look at the evidence to see if there's uncertainty or not. But I think that there's going to be a challenge in these types of cases where there's lots of outcomes we care about, and there's, at least with one intervention, there's a reasonable expectation it'll be better. It'll be more effectively realize at least one of the outcomes of interest than comparing to the alternative interventions. Okay, so what I do in the paper, I'm not going to discuss everything in the paper, obviously, is I look at some existing approaches, largely from the clinical research ethics field. And then I develop and defend a view I just call the greatest value view, and then try to specify the implications for just like thinking about how you might apply this to cases. And I'll admit, like, just insofar as I'm an ethicist, not a practitioner, that's sort of the weaker part of the paper. Okay, so what are some existing approaches? So one way that clinical research ethicists have tried to think about this is to say, well, maybe what we could do is we could, just appeal to the judgments of individual patients, right? So you can imagine, like, you have a treatment for a certain type of cancer, and we want to determine if it's better than maybe a new experimental intervention. We might know that, like, one of these interventions is better in terms of survival over a certain period of time, but maybe it has really bad side effects for patients. So we want to see, like, hey, is this other intervention that maybe we know is less good on survival is actually better on quality of life? And so in terms of like how we apply the equipoise idea here, Fred Gifford a while ago said, well, you could just appeal to the judgment of individual patients, right? You could just ask patients, are you indifferent? Given what you know about these two treatments, are you indifferent between them, right? And if you are indifferent, then we can flip a coin to see which one you get. We can run an RCT. So the biggest problem here with this approach is just, as David said, a lot of times we're doing cluster randomized controlled trials. We're not getting informed consent to be subject to an intervention. And so you just can't do this kind of exercise in most cases. Another view that's out there, and this is, I would say, inspired by work by Alex John London, who's, again, also working in sort of the clinical research field. And so I'm sort of like not attributing this view to him so much as just sort of building it out from his work a little bit, is what I just call the dominance view. And so here the idea is, for one intervention to be superior to another, it needs to dominate the other. So it needs to be better in terms of all outcomes of interest that we care about. And so the worry with this view is that it's just an incredibly high bar for superiority. So for one intervention to be superior to another, you need to have kind of a reasonable expectation it's going to be better than all the outcomes that we care about. And so the worry, insofar as we want equipoise to sort of tell us when it's okay to randomize, when it's okay to not randomize, it's just this would be way too permissive, right? It's going to allow probably RCTs on everything, just because there's always going to be uncertainty about dominance. So what's the view I come up with? So the idea is that one intervention is superior to another if and only if it's reasonably expected to realize a more valuable set of target outcomes or just outcomes of interest than the other intervention. And so thinking about, if you think back to this case with which I began, you have a set of outcomes. We're reasonably confident one is better than another on some of the outcomes, but not all of them. And so to think about whether one intervention as a whole is superior to the other, we want to think about two things. So one is, do we care? Are some of the outcomes more important than others? So do we have reason to care more about, say, food security than usage of healthcare resources, at least in this policy context? The other thing we want to think about is just the degree to which each intervention is reasonably expected to realize the outcomes in question. So is it the case that intervention is going to be actually going to really be much better on food security or something compared to the other intervention? So what's the justification for this view? So here I sort of lean on work I've done elsewhere, and a lot of the background here is just thinking about policy research and the role it should play within the scope of government, and how government and policymakers should think about policy research. And so the basic background idea is just that governments have duties to do things for people. And so I use this idea of target outcomes as a kind of a shorthand for this. but just the idea that governments have obligations to provide people with goods and services, to realize certain outcomes along health, education, and so on. And so then the way they do that is they implement cost-effective policies. And I think crucially also need to do research, right, to figure out what policies are actually going to be effective in realizing these outcomes that we care about. And so here I really like this quote from Alex John London, his book in 2022. He says, the moral purpose of research is generating information that is necessary to close gaps in the ability of the basic social institutions of a community to secure and advance the basic interests of its members. So if we start there, we can say, look, so since the aim of government is to realize these outcomes for people, and in doing so fulfill duties of justice it owes to people, then when we're thinking about which intervention is better than another, we should evaluate it in terms of the degrees to which they can realize these outcomes. So this leads us to the greatest value view. So A is going to be superior to B if and only if it's reasonably expected to realize a more valuable set of target outcomes. And so one way to think about this is that, when we're thinking about the superiority of an intervention, where we judge, like, this intervention is superior to another, we would say, look, society would be more just if we implement this policy as opposed to another. Okay, so how do we apply this? And again, as I mentioned, I think this is, because I'm an ethicist, this is sort of the weak point of the paper. Really what this means is when you're planning an RCT and wondering if equipoise applies, you think about, okay, what are we trying to do here? What are the outcomes that we really care about? We want these interventions to promote. We think about the value of these outcomes against each other. Is one more important than others in this particular space? We ask whether we're, there's my timer, and I'll be quick here. We ask whether we've met this epistemic threshold such that we're confident that we have evidence that at least on this outcome, this intervention is better. And I think the difficult thing is, like, once you've sort of done all that, you got to make this really difficult value judgment about which intervention is better, where you're comparing a lot of these different factors. I think, like, tradition of, like, political philosophy, offers resources here. You could also think about community engagement processes as ways to deal with this. And also just looking at, like, how in the policy context are people thinking about this? What are they prioritizing? What do they want these interventions to do? So just like last slide, so just thinking about this study I started with, on my view, I think that what you would argue is that equipoise is not satisfied if you're comparing these two interventions. The cash transfer plus existing social safety net is better, right? It realizes target outcomes to a much better extent than the other, at least given the existing evidence. And then the final thing I would say is that the way I think about equipoise, and this follows the ethics appendix that Sidhu and all have put together, is it doesn't mean you can't randomize, right? So equipoise is like a sufficient condition for fair randomization. If there's equipoise, it's okay to randomize. But there's also other conditions under which it would be fair to randomize. And so one other condition that might apply in this type of case is if the cash transfer is scarce, you need to distribute it. You can't give it to everybody. And so there could be a situation where it's fair to conduct a lottery to see who gets it. So thanks very much.
Great. Thank you very much, Douglas. And we've had a couple of questions come in. So one is from Moses Nguare, who is asking, I like the idea of proceeding with random assignment. Oops, it just went away. So, let me see. It was taken away from there. Well, anyway, I think the question was about, when there is uncertainty. And then the question is, what is, how do we determine, what is uncertainty?
Yeah.
That was an excellent one. And then there was, again, it's taken away now but there was another question about, and I think it relates a bit to my question as well to you. It's interesting, we're talking about, well, when you have different outcomes and some of them it's superior in some, but in some it's not, etc. And so how do how do you judge across? And you talked about, like ask the patient or whatever, like that being an approach, or let's, ask government, etc. So there was one question there related to sort of, well, not all governments, or quite few are really looking necessarily out for the best of the of their country, etc. So there was a sort of a question around that, and in my case, I was thinking about, I was a bit surprised not to hear anything about, thinking about statistical value. So the statistical value of life is something that has been used sometimes to, or statistical value across across our actions. We behave in certain manners to indicate our preferences. And I was wondering your thoughts on applying that. So let me stop there.
Okay, so let me take two of those, and I think I'm going to punt on both of them, but I think that these are future questions for research. So one question I think that hasn't really been answered in the literature, and that I think I need to, I'm planning, I'd love to write a paper on this. I'd love to partner with a social scientist on this, is just thinking about, when do you have enough evidence about an intervention that you sort of meet that epistemic threshold. And what I mean by that is that it becomes like, it would be unethical to randomly assign people to something that is a control or something like that. And so I think that you really need to think carefully about what types of evidence we're thinking about, and you kind of need something that's going to provide researchers with guidance and research sponsors with guidance. So I think there's actually like a really important paper to be written there about, when do we meet an epistemic threshold such that we're confident in this intervention that we don't think that it should be withheld from people. We think we should be implementing it. So the second point, I think on like statistical value of a life, I think that there's a lot of potential methods out there where, if you were going to sort of take this idea and thinking about, okay, how are we going to systematically think about what intervention is going to promise us the greatest value? I think, again, another next step for research is to sort of look at more formal methods that have been developed. And so one of the ones I talk about in the paper is, which I think connects with what you just mentioned about, statistical value of a life, and you could think about qualities and things like that as well, is just using something like a social welfare function, right? And I think that there's ways to do this. And my concern, or why I think we've got to think very carefully about it, is just that when you're talking about like which intervention offers the sort of the most valuable outcomes, it just raises very difficult normative questions. And I think, like a lot of ways with social welfare functions and things like that, you're often really reducing these really complicated outcomes that we have different reasons for caring about to often one thing, like taking considerations of freedom and respect for rights and just thinking about them purely in terms of welfare or well-being. And so I just worry about, like, in some ways I think we should want to, and this maybe follows a little bit from David's thought, that it's okay to sort of sit with some uncertainty and sit with some ambiguity and just have good reasons for why we're going. We don't want to be too simple and just sort of not recognize the messiness of the normative sphere, the messiness of ethics when we're making decisions.
Great, excellent, thank you. Now we're gonna go straight into the next presentation. And so next we have Sridevi, who was previously at 3IE and is currently pursuing her PhD at Emory University. Sridevi will present her co-authored paper, which is titled "A Checklist to Guide Sensitivity Analysis and Replications of Impact Evaluations." So over to you, Devi.
Thank you, Marie, and thanks to 3IE for hosting this panel. So yes, I'll be presenting a checklist that we developed to help guide sensitivity analyses and replications. And so before I really dive into the paper, I want to just take the time to kind of define replication, because this is a term that's been used in many different contexts and has different meanings depending on who you talk to. And so the 4 types of replications I've identified are, first, computational reproducibility, which is where you run your original code on your original sample, and you have a goal of assessing if the findings can be reproduced using original code and data. So thinking about transparency. Then we have what 3IE calls peer replication. And so this is where you reproduce your analytical code on the original research sample, but you're using the methods section from the journal publication and the pre-analysis plan to guide your analytic choices. And so this goal is to assess if your findings can be reproduced using the published method, so thinking about reproducibility. Then we have our measurement and estimation analyses, which is where you're conducting sensitivity analyses and robustness tests on your original research sample to assess if the findings are robust to additional analyses. So think about a goal of credibility. And then finally, I think this is the most common use of the term replication, but our external replications, which is where you're using your same methods as your original research, but on a new sample, with the goal to assess if your findings can be reproduced in a new sample. So thinking about external validity. So in the context of this paper, I'm going to be focusing on measurement estimation analyses and talk about guidance related to that. So currently there has been very little guidance on how to conduct this type of replication, and it's often left up to the replication researcher to decide what should be done. But replications such as these allow us to assess which findings are robust, which helps us make science a self-correcting system and really helps us think about major downstream effects on policymaking. So motivated by the potential for replication studies on improving the credibility of landmark impact evaluations, 3IE implemented the replication program in 2012. So between 2014 and 2022, 24 replication studies were funded across multiple international development sectors, including cash transfers and HIV prevention. And so the goal of this program was to help improve the credibility by replicating the findings and seeing how robust they were to additional sensitivities. And so initially, the guidance to replication researchers was left really up to them. They could identify a study that they deemed influential or perhaps was influential to certain funders, develop their pre-analysis plan on what they thought should be tested in terms of sensitivity analysis, then they run the analyses and publish a report with their findings. However, as the replication program was undergoing, there were concerns that there was replication researchers are kind of picking analyses that weren't aligned with the original studies and would overturn their findings. And this led to tensions between replication researchers and the original study authors being very high. And one of the ramifications of what happened was that there's this perception from original researchers that they shouldn't really be trusting replication research of their own work. And why is this a problem? So if we have distrust and lack of confidence from original researchers about the intent of replication research, it means they're less likely to want to have their studies replicated. And we're thinking about decision-making down the line, having studies be replicable could be important criteria for meta-analyses or other syntheses that can inform decision-making. And so this perception also is really going against what open science has been trying so hard to do over the last few decades. So with this in mind, colleagues at 3IE and I developed a checklist to help guide replication research. And the objective of the checklist is not to provide a comprehensive prescriptive list, but meant more as a tool for both replication researchers as well as prospective impact evaluation researchers to use when selecting sensitivity analyses. So Annette Brown and Ben Wood, who ran 3IE's replication program, wrote this article called Witch Tests, Not Witch Hunts, that provided some guidance on tests that could be run for replication research. So we took their work as our initial primary taxonomy, and then focused on 6 common impact evaluation designs of RCTs, difference in difference, instrumental variable, interpreted time series, matching, and regression discontinuity design to identify what categories should be in our checklist. So we followed a 2-step approach to identify both resources and attributes to include in our checklist. So we first identified a list of foundational resources that are used for common impact evaluation methodologies. And then we used an unstructured keyword searching and backward citation tracking to identify 31 resources in our checklist. We then reviewed 3IE's replication studies to identify potentially other checks that should also be included. So I'm not going to go into too much detail about what's within each or kind of the actual checklist itself, but I just want to kind of point out that there's the common 5 categories as well as kind of how our checklist is laid out. So each category is structured the same way, and it's kind of this example we have on the right. So the first column is a key attribute or the assumption that potentially may have been violated or has not been met. We have a recommended test or check for that attribute that's been based in the literature. And there are 2 open columns. The first is a comment that the researcher can use to fill out kind of how they felt, whether or not this attribute had been met or if it was violated and why they thought so. And then an action about what they were going to do related to their comment. And finally, the final column is resources, which includes a list to literature for that specific attribute, about additional tests or as well as additional justification or explanation about that. So there's 5 primary categories within our checklist. The first is validation of assumptions or conditions. So this presents our general causal inference assumptions, such as the stable unit treatment value assumption, as well as identification strategy specific assumptions. So in our example table on the right, this first row is about the relevance condition, which is an assumption for instrumental variable. The recommended test is that if it's not met, you check the association between the instrument exposure. In our example, the replication researcher didn't believe that this was necessarily explicitly tested, and so they wanted to run a t-test and test association. Then we have a section on data transformations. This is not exhaustive, but just kind of provides guidance on potential data transformations that the replication researcher may want to perform. Estimation methods also provide some guidance on alternative estimation strategies that could be chosen. Heterogeneous outcomes looks at how to potentially explore heterogeneity within each studies, though caution on interpreting those results just because of implications of multiple hypothesis testing. And then finally, we have our standard checks. This is just like a generic list of checks that we've identified should be checked within each replication study. So for example, our second line in this example table is from our standard checks, which is concordance with pre-analysis plan. The recommended test is that there are additional primary outcome analyses that were detailed in the pre-analysis plan of the original study but not conducted. Those should be performed. And so in this example, the comment was that the original study authors conducted all analyses and no additional action is needed. So I just want to quickly go and take some time to go through how we piloted this checklist. So actually in the very last replication study that 3IE published was this pop-art replication that I led with my colleague, Doug Landon. And so we use a checklist to create a replication plan. So I'm not actually going to share the results from the study, but just how we use the checklist. So some quick background on the pop-art study. The pop-art trial was an HIV combination prevention trial that was looking to examine if a universal test and treatment program, along with a combination prevention intervention, could reduce HIV incidence at the population level. The trial was conducted in Zambia and South Africa, and it was a cluster randomized trial with 2 treatment groups and a control group. And so the primary outcome was to evaluate the effect of combination prevention intervention on the population level HIV incidence. And so at the end of the trial, the overall impact estimate found that the universal ART intervention group, which also had the combination prevention intervention, didn't actually end up having an effect on HIV incidence relative to the control group. So 3IE was commissioned by the Gates Foundation to conduct a replication study of this pop-art trial. And so when we were going through the study materials and we're thinking about our validation of assumptions and conditions, we noticed that there were some clusters in the trial that were contiguous or close in proximity between treatment and control areas, which could potentially lead to violations of the no interference component of SUTFA. And this is especially important when you're thinking about sexual networks that may overlap across clusters and impact HIV incidence. So our comment here for that attribute was that the geographic boundaries of treatment areas may be in contact with control areas, they just potentially spillover effects. And our action was to do what is called a fried egg study design, where essentially you use GPS data to restrict your treatment areas such that the boundaries no longer overlap. Another area we identified was that the authors had highlighted that the migration between groups may have contributed to the null result in group A, but they didn't necessarily discuss how they handled migration in their analyses. This could also potentially lead to a potential SUTFA violation of the no interference assumption. So our action was to right censor migrated participants. I just am combining our data transformations, estimation strategies, and heterogeneous outcomes into one table, just for simplicity for today. But for example, under data transformations, we were interested in kind of how they were using imputation methods. So they were using mean values to impute person time, which is a key component of estimating rate ratios. And so we were unclear if this was using random seeds or if these were hard-coded. So our action was that if this was hard-coded, we would try a different alternative imputation method to use random seeds to impute person time. With the estimation strategies, we're interested in understanding kind of like how they were aggregating. So the original authors aggregated all their analyses up at the cluster level, which ignored potential individual level variation. And so our action was to run an alternative estimation strategy where we used an individual level model with clustered standard errors and bias correction methods. And then finally, to look at heterogeneity, we were looking at kind of geographic subgroups. So we noticed that from one of their diagrams and figures that there's 3 control triplets that ended up having lower HIV incidence and treatment. So our action was to look at exploratory analyses of these triplets. And finally, this is kind of just a quick look at our standard checks. So for some of the standard checks, specifically the concordance with pre-analysis plan and the treatment of outliers, we didn't actually see any action needed. So just to conclude, we believe that this checklist is a value add to the impact evaluation sector. One is that it actually compiles all these various attributes and resources into one guidance document. It also complements additional transparency or reproducibility resources that are currently available. We don't expect that this checklist is going to be prescriptive or exhaustive. However, we think this could be a starting point for both impact evaluation researchers who are designing their own sensitivity analyses, as well as replication researchers to use as guidance with their original research. I just want to quickly give some acknowledgements to my co-authors, as well as to other 3IE staff who helped manage this project, as well as provided some feedback, and then finally to acknowledge our funding support from the Bill and Melinda Gates Foundation. Thank you.
Wonderful. Thank you, Debbie. This was great and an excellent resource, I think, to the research community. I have a question from Benjamin Wood, who's also former 3IE and as you one of the originators of this work and one of the co-authors of the paper you mentioned earlier. So he says, great to see 3IE continuing to build on the replication work. Based on the checklist, do you think original authors would be more excited or interested in having their papers replicated now than, has the attitude changed, I guess this is what he's asking. And then I'm going to, while you're answering, I'm going to put Ashu on the spot. If you're like, Ashu, how would you feel about being replicated in your current or latest paper? So just any thoughts on that? But first to Debbie.
Yeah, I think, Ben, that's a really helpful question. I think actually it could help simulate additional interest replication research. So when we're doing the pop art replication, I think having the checklist was really helpful in the guidance, like the dialogue we had with the original researchers, because we were able to point to kind of justifications and documentation as to why we were looking at these specific analyses, rather than saying oh, we just saw this and we kind of ad hoc chose that. And I think that really did improve our relationship with the original researchers. Because we're also able to point there's a lot that the original researchers did meet and we didn't have to take action on that. And so I do think there hopefully is some more excitement. I also had the opportunity to present this at the BITS annual meeting earlier this year. So hopefully there is a lot of interest in replication. I put out one of my slides, but the Institute for Replication actually runs replication games every year where people come together and do these replications. So I think there has been a lot more interest in having more replications done and original authors kind of wanting to collaborate with replication researchers. Thanks.
All right, thanks. Ashu, do you take the bait?
Yeah, no, I think it's good because a couple of my studies have been funded by 3IE and back in the day before I was kind of part of the team. And one of the requirements was to undergo replication. And I looked at that, and at the time I said, well, hopefully they'll ignore that. But in fact, I think in a couple of my most recent studies that were funded by 3IE, we went through the replication process. We were very nervous. We didn't know what the goal was, and we didn't quite understand. We came out successfully through the process. It was like going to the dentist. And I will say that kind of reading your article, Sridevi, and listening to your presentation, I think, yes, for sure, this makes authors like myself feel much better that there's kind of this structured approach, right? And the purpose is clear and so on. And I think really educating, people like me, researchers, about the scientific value of this is super, super important, right from the get-go. So I think all of this is a positive, and I have had a bit of an evolution myself on this topic. Thanks for asking.
Right, thanks for taking that on the spot. Thank you. Then over to our fourth paper from the special issue in JDEff. So next we have Indira Patil, who also was previously at 3IE and is currently also pursuing a PhD at Purdue University in her case. So Indira will present her co-author paper, which is titled Surveyor Physical and Emotional Well-Being, Learning from Indian Context. So very exciting. Over to you, Indira.
Thank you, Marie. Hi, everyone. Very excited to be here today. And thank you for your interest and participation in the session. This is a joint study with my former colleagues at 3IE, Dr. Chandan Jain, Rohan Shah, and Soumya Mathur. To begin with the motivation for the study, being part of the research community, we are all aware about the importance of good quality data. Good quality data forms the basis of evidence generation in international development. And more often than not, the data is collected using primary surveys. Surveys run for days and are usually planned in a manner to keep the costs low. Sometimes surveys are done in difficult contexts that might pose risks to the health and safety of the surveyors. Surveyors or enumerators are also exposed to difficult situations and respondents on ground. Most of us who have engaged in primary research might have anecdotal instances about surveyors being underpaid, working with limited resources, and in difficult conditions. However, when we tried looking into the literature on surveyor well-being, we could not find many studies that systematically documented the health and safety challenges of surveyors. In the context of India, for example, there were very few reports or media articles documenting this. One such media report was published, say, about 6 years ago by a renowned online media platform and highlighted the challenging conditions in which the National Family Health Survey around 4 enumerators worked in. The literature and the discourse on research ethics mostly lays emphasis on the rights of the research participants in terms of institutional review board, human subjects certification, provision of incentives, and relatively lesser attention has been focused on the issues and processes around the well-being of field research staff directly engaged in the data collection. We understand that it is difficult for IRB to look into the enumerator side of things, but an acknowledgement of the fact that it is an important area of concern and focusing on institutionalizing some of the measures to ensure the safety of the research staff is also important.
Indira, is that just me coming in here? Can you change to full view of your slide?
Okay, sure. Is this?
Yes, perfect.
Better?
Thank you.
Okay,
Yeah.
okay. I'm sorry. So in terms of the objective of the study, we do 2 things in the study. First is identify the key health and safety challenges during the primary data collection. And secondly, we suggest some of the best practices that can be adopted to mitigate the health and safety challenges of the surveyors. So this is primarily a qualitative study, descriptive in nature, and focuses on the case study of surveyors from a 3IE commissioned baseline survey. We collected data for the study primarily from 3 sources. The first being a survey of surveyors. So after the baseline survey, we conducted a short survey of surveyors wherein we asked close-ended and open-ended questions about focused on basic demographic details like age, gender, professional experience, what challenges the surveyors faced during the survey, and also what are some of the measures that they suggest to mitigate the challenges that they faced during the survey. So this was the first data source. The second was in-depth qualitative field essays of 25 enumerators who participated in the 3IE Commission Baseline Survey. These essays were actually kind of moderated or are asked by the surveyors to be written by the data collection agency. And they asked the enumerators to primarily focus on the challenges that they faced during data collection. And again, if they had any feedback in terms of improving the institutional measures or other measures to mitigate the challenges. The third data source was semi-structured interviews with 5 managers from 4 different data collection agencies based out of India. These interviews focused mostly in understanding what are the market practices, current market practices, and as well as institutional level challenges and measures that different organizations follow around health and safety of the enumerators. Just before delving into the health and safety challenges, I wanted to quickly take you through the background of the surveyors based on the survey of surveyors data that we had collected. So the average age of surveyors is about 29 years. In fact, this was also corroborated by the managers during their interview, saying that the surveyors are mostly young, fresh graduates. And if you can see the pie chart on the right side, most of them are have a master's degree and a bachelor's degree at least. So they are well educated. And most of them view surveyor job as a secondary or a makeshift job and are mostly applying for government jobs. In fact, during the 3IE survey itself, like in 2 instances, we had to declare, the data collection agency had to declare holiday because over 70% of these surveyors were planning to take a government exam because that was what was their primary interest, and they viewed surveyor job as a makeshift job. Then in terms of the average daily wage paid to the surveyors, the wage kind of ranges between 900 to 1,200 rupees depending on the context. This is also a function of the minimum wage prescribed by the states. For example, in a state like West Bengal, the minimum wage would be like about 900 rupees, whereas in Gujarat or Maharashtra, where the government prescribed minimum wage is slightly higher, as well as the wage as compared to alternative livelihood options is higher. The average daily wage paid to the enumerators is about 1,200 rupees. And the average daily wage consists of 2 components: the per diem component, which includes food and accommodation reimbursements, and the travel allowance. And in terms of contracting, most of the contracts developed by the data collection agencies with the surveyors is a short-term 89-day contract. That is because if the contract exceeds 90-day period, then they have to provide retirement benefits or gratuity benefits as per the law of the law of India. So that's why they restrict the contract period for 89 days. And if they have to renew the contract beyond 89 days, there is a cooling off period of 7 days, and then they again renew the contract. And in fact, like most surveyors said that they would definitely recommend the surveyor job to a friend or a family member, as you can see from the graphic. Now, coming on to the health and safety challenges of surveyors, the common physical health challenges faced by the surveyors included flu, back pain, skin rashes, dust allergy, and these were primarily emerging because of physical exertion, irregular meal timings, and infrequent access to toilets, and also long travel times. These were minor health challenges and were not covered by the insurance provided to the surveyors, and that's the reason it increased the out-of-pocket expenditures for the surveyors, and it also affected it also affected their income in terms of the fact that there was no paid leave for such minor physical health challenges. If they did not work for a day, they would not be paid for that day. And also, most of the surveyors had a group policy in terms of accident and health insurance, but there was less awareness in terms of how to claim those procedures. In fact, most managers that we spoke to said that we provide insurance, but in terms of examples for claiming insurances, they said that they hadn't come across so far in terms of any enumerator claiming these insurances. So there was an absence of institutional mechanism and information sharing to manage everyday health issues while on field. So that was another challenge. In terms of mental health challenges, the stringent productivity target, the pressure around that constantly lingered on the minds of the surveyors. I think it is important to acknowledge that completing a survey is not just not just dependent on the surveyor, but also dependent on the research participant who can be accessed or whether they are available or not. So I think it is important to acknowledge that to count the attempts made by the surveyors as also part of productivity targets and not just focus on the completed surveys. The other mental health challenges were like the uncertainty associated with the non-permanent nature of the job. The 3i survey happened during 2021, 2022. So there was low COVID risk, but there were still some cases of COVID-19. And surveyors being frontline workers, COVID-19 related risks were other challenges. And also there was a lack of institutional support in terms of counseling and information sharing around mental health. So these are some of the quotes from the essays and the program manager interviews wherein they say how productivity target is kind of affecting their mental health. In terms of safety challenges, we observed that it was gendered, with women enumerators reporting greater risk of harassment and limiting hygiene practices at workplace. Given that the field team structure is mostly skewed in terms of gender, because supervisors and managers are mostly men, and women enumerators do not feel very comfortable in opening up around these discussions. The prevention of sexual harassment policy was applicable mostly for the internal team. But when it came to some instances with the community members, it was not easily enforceable. The act or the policies were not enforceable in such cases, and it was challenging to deal with such cases. Also, absence of permission from adequate authorities for conducting the survey posed some safety-related challenges. So we actually, based on the interviews of the managers and also looking through some of the best practices being undertaken at 3IE and some of the other organizations, we developed a list of measures, suggestive measures that can be adopted to mitigate some of these challenges. And these include providing adequate travel facilities where the location is far from, say, the village, town, or city where the surveyors are staying. Then encouraging and ensuring timely breaks. This definitely helps both the physical as well as the mental health of the surveyors. Provision of holiday and paid leave for field staff. Currently, there is no paid leave or holiday during the contract period. Setting up institutional standard of operating procedures for health emergencies in the field. Increasing awareness about accident and health insurance, as well as the prevention of sexual harassment policies. This can be actually integrated with the training of the enumerators. One of the suggestions we provided was maybe the last 2 days of the training could be dedicated around this and to increase the awareness among of the surveyors around these issues. Planning adequate budget and resources for data collection and field team personnel. Accounting adequate time for pre-field measures in project timelines and including them as deliverables in survey firm contracts to ensure that they are properly implemented. Having a streamlined feedback system to enable regular communication between surveyors and supervisors and managers is also important. All of the survey firms that we spoke to did not have a mental health professional or counselor in place. So maybe appointing a mental health professional or counselor would definitely be important and send a strong signal in terms of the emphasis laid to the mental health issue of the surveyors as well. We definitely need mixed gender teams in the supervisory and management roles. Getting required permissions from adequate authorities is important, and conducting pilot not only focused on data collection tools, but also understanding the context and associated challenges is important. I would like to conclude by saying that the study, I mean, we have a long way to go in terms of understanding and establishing the challenges faced by enumerators in a more systematic manner. The limitation of the study is that it was focused on a particular case and is definitely not generalizable beyond this particular context. But I think for future research, this is an important issue, and that it's something that needs to be looked into carefully. Thank you.
Thank you, Indira. Indeed, a very important study, and thanks for you and co-authors to really shed light on very important and key, actually, contributors to our primary research, the enumerators and their well-being and the risks they face. And particularly, my one question was going to be to you, what are your concrete recommendations? And you had a lot. So I will, in view of time, I will, and I have not seen any specific questions come into you, I will proceed with the agenda. But I'm seeing everybody's very good at answering all the questions online. So please continue, keep that up while we proceed and closer to the hour. So first of all, we'd like to extend sincere thanks to all the authors who decided to submit their papers for the special issue. And also wanted to acknowledge the support received from the managing editors, the JDEff team, and reviewers in helping us put together the special issue. We're not done yet with the session, but this was the special issue session. And then quite at the end here, I'm now going to invite Chandan to briefly present the tree review framework. Chandan is a senior evaluation specialist at 3IE, and he manages our 3 initiative. So over to you, Chandan, for the last few minutes.
Sure, Marie. Can you confirm if you can see my screen?
Yes, we can.
Okay, so just in the interest of time, so I'll be sort of speaking about and briefly about a tool that we have developed to promote the uptake of best practices in evidence generation. So this is called as the tree review framework. So the tree stands for transparent, reproducible, and ethical evidence. So I'll skip the motivation and background, given that a lot of discussion has happened around it. But the main sort of motivation for us to develop this tool was that there are these risks that exist to the evidence generation process. These are risks related to the credibility of the evidence, the usability of evidence, and the risks that exist with regard to research participants and staff. So when I say credibility of the evidence, these are risks related to p-hacking, selective reporting, or lack of reproducibility. Then with regard to the usability of evidence, there are risks with regard to whether or not the decision maker will be able to use the evidence that's being generated. And with regard to the third risk, I guess Indra has already spoken about that. Now, in the literature, there are a lot of mitigation mechanisms that exist, and as a community, we have been sort of using these mechanisms. So these are mechanisms related to study registration, pre-analysis plan, then IRB committees, and with regard to the usability, we have mechanisms around evidence gap maps and systematic reviews as well. And over top of these mechanisms, there are further institutional policies that guide authors around transparency and credibility in the evidence generation process. Now, the fact is that despite having these mechanisms and these policies in place, what we see in reality is that the evidence that is being generated, they do these studies that are generating these evidence, they lack adherence to these best practices. So some of these has already been sort of some of this has already been sort of suggested by recent literature, especially in the social science research, as well as some of our own work within 3IE, wherein we are using the DEP data that has information on the past impact evaluations. What we see is that a lot of papers, a lot of studies do not adhere to the best practices that we would want them to do. So what we've done at 3IE is to basically build this tool, which is called as the 3IE tree review framework. And what this tool does is it basically pulls together consideration for all these risks under one process. So I'll quickly sort of take you through this tool. So the aim of the tree review framework is to document research practices to be able to make them align with the best practices in evidence generation and also ethical requirements. Now, the thing is that this tool is publicly available. You can access it at this website. My colleague will also sort of share the link to this website in the chat box. So you can go there, you can register, and you can start using the tree review framework. Now, there are 3 objectives of the tree review framework. First is to establish ethical standards. Second is to better integrate best practices into research workflows. And the third is to enable timely and independent oversight of the risk that are facing the research team to produce credible, meaningful, and ethical evidence. In terms of the components within the tree review framework, so there are 3 main components. One is the tree review questionnaire. And what the questionnaire does is that it basically asks for the research team to document their current research practices around these 10 ethical guidelines that we have here. And the idea is to understand how the research team is doing with regard to various best practices, such as having, say, a pre-registration of the study, a pre-analysis plan, thinking about confidentiality, having a theory of change that guides the research design, declaring conflict of interest, etc. So the scope of the tree review questionnaire is wide enough to be able to gather information on multiple of these aspects that are important for producing credible, transparent, and reproducible research. Now, when we come to the milestone aspect, so ideally what we recommend is basically filling the tree review questionnaire at the start of the research project, and then over time updating it with further and newer information, so that over time, as and when the research teams start actually implementing the research, they can further include more information that's coming from the different decisions that they're making with regard to their research workflow. And the third is basically doing an independent review. So what we do at 3IE is that whenever we are doing a tree review for a study, we establish a team that has experts from evaluation, that has experts from the context wherein the research will be implemented, so that they can look at the filled in questionnaire, or they can review the filled in tree review questionnaire by the study team and can suggest changes to them. And then over time also sort of monitor how changes are being implemented to the tree review questionnaire. So at 3IE, we are doing we are implementing tree review for not just internal studies, but for external research studies as well. And we have implemented this for different partners. To give you an idea of what the process has been when we are doing it for external partners. So the first step that we do is to invite the study team to submit all the relevant documents to us, which includes the research protocols, questionnaires, and if possible, the completed tree review questionnaire as well. The second step is to establish a tree review committee. And as I said, that the tree review committee basically will have a representation from an evaluation expert, then an expert who knows the local context, and then other supporting members as part of the committee. Now, what the committee does is it goes through all the protocols and the tree review, or the filled in tree review questionnaire, to look at alignment with best practices, and accordingly it suggests changes to the study team. So the key issues that are identified as part of this review are then highlighted to the study team, and they're given sort of chance to update their protocols to be able to align better with the best practices. So with that, I'll just quickly sort of end the presentation. I'll encourage all of you to basically go to the website that I mentioned and look at the tree review form, and feel free to use it. If you have any further sort of doubts, feel free to reach out to us as well. Thank you so much. Marie, back to you.
Thank you, Chandan. Thanks for sharing the information about the tree review framework. And I'd like to second your suggestion for researchers to use these amazing tools and frameworks that are available. Also, special thanks to Chandan for being the driving force and getting this panel all together. I'm not going to summarize each of the papers that were presented in view of time, but thanks again a lot for the various presentations on this important topic, and please ensure to read. You've gotten a lot of responses online. One suggestion, I saw a very good question or comment from Mead Over online, and I can see that there's a potential joint paper with Douglas in the future, where Mead is suggesting a more Bayesian approach to what he's doing. So I hope you can talk together about that. So with this, we come to the end of the evidence dialogue. Thanks again to the panelists, to the whole team at 3IE that made this event possible, and to all of you for joining us for this engaging panel discussion and all the excellent questions and comments online. The live stream of this video is also uploaded to 3IE's YouTube channel. And if you would like to continue the discussion on Twitter again, or X, please tag at 3IE News, or indeed, please follow up also on our LinkedIn posts. You can also subscribe to email updates from 3IE by visiting our website, which is 3ieimpact.org. And in this way, you can learn more about future events in this evidence dialogue series. So we look forward to seeing you in upcoming events. And again, thanks very much, everyone, and wishing you a very good day, morning, afternoon.